This is the Type 1 Tribe podcast, and I am your host, Samantha Hildebrandt. I was diagnosed with type 1 diabetes on February 18th, 2021, and now I am sharing all of my experiences and knowledge with you. So let's go. Today, our guest is Barb Woegerer, a licensed naturopathic doctor in Toronto, Canada. She is super passionate about the mineral magnesium, and we dive into the importance of taking magnesium daily, especially for people living with type 1 diabetes. I'm personally a huge fan of magnesium, so this was a super fun conversation for me to have with Dr. Barb. Are you ready? Let's go. Who should be taking magnesium that isn't currently taking it?
Short answer, everyone, but we're going to break it down. So most these are people that really need magnesium. A lot of us are deficient, just across the board, but the ones that should be taking it or really have an emphasis on taking it are people under chronic stress. So stress burns through our magnesium, and then of course this depletes what magnesium is in the body, and then of course things don't run as smoothly. Those who consume a lot of caffeine or alcohol, because both of these increase magnesium loss through the urine. We also have people with digestive orders, so irritable bowel syndrome, Crohn's, colitis, because they have malabsorption issues. So they're going to have a much harder time absorbing magnesium. And so they're going to obviously have lower levels. Athletes, people who exercise a lot, who sweat a lot, they're losing magnesium through the sweat. We know that magnesium is part of the electrolyte portfolios with sodium and potassium and chloride. And so if we're sweating a lot or we're having a lot of caffeine use, we are obviously losing some of that magnesium as well. People with insulin resistance or diabetes, and this is because magnesium plays this key role in glucose metabolism and in insulin sensitivity. So it's a benefit for them. Plus, we know that if you're insulin resistant, you're probably excreting some of that magnesium as well. People who are going through menopause, so women going through menopause, estrogen helps to retain magnesium. So we often see a levels of magnesium drop. And then anybody who is taking any type of medication that is depleting their magnesium levels. And some of those can be birth control pills, blood pressure medications, antibiotics, acid blockers like proton pump inhibitors, or diuretics for high blood pressure.
Wow, so you were not joking. Pretty much every single person can benefit from taking magnesium. So,
Right.
is it safe to say that we can all assume we're maybe lacking in magnesium and it's safe to just start taking some type of magnesium in some sort of form?
Yeah, so unfortunately, there is not a great test that we can do for magnesium. So, yes, most of the research says somewhere between 50 and 70% of the population is deficient in magnesium. And it's only because of some of the things that I listed depletes magnesium. So there's so many things that actually depletes our levels. So unless you're living like stress-free, not eating any sugar, you don't have any medications, you have no illnesses, you're completely healthy, you're not really getting a lot of magnesium. There is some in foods, and that's great, but it's also harder now to get those same nutrients. So because we don't have the testing that can significantly, because the other thing is the testing tests blood, and only 1% of magnesium is in the blood. So the rest is in the bones and the tissue. So if you really wanted an accurate amount, you'd have to do like a muscle tissue biopsy, which I'm sure not most people are not going to line up for that. And there is a blood test called a red blood cell test, and that is probably our most accurate one, but it's still not 100%. And at that, you want to be at the very high end. So, long answer to your question, yes, most people will likely need to supplement in some form or manner.
Wow, that is so interesting. I didn't know about the blood, how it's only a little bit in your blood because I've had doctors test it for me before and they were like, "Oh, your magnesium's fine. Like you're fine." And I'm like, "I don't feel fine." So
Right.
that's wild. Okay.
Yeah, yeah. And that is because they're testing your electrolytes, right? And so that 1% in the blood is part of that potassium, sodium, and they'll usually run those tests as well. You'll see it kind of together, magnesium, sodium, potassium. And some will even put in chloride, but that's really all they're testing. Yeah.
Interesting. So what are some common symptoms that somebody would have that would say, okay, you probably are lacking magnesium?
A lot. So big ones are muscle pain, joint pain, sleep, stress, right? They're not handling their stress very well. Insulin resistance, because if you don't have enough magnesium, you cannot sensitize the insulin receptor. A lot of health conditions, so mood, anxiety, depression. There's just so many symptoms. This is also why nobody really most of the deficiencies of magnesium deficiency, or most of the symptoms of magnesium deficiency, actually are part of other health conditions. And so, because there's so many and they're so random, a lot of people will not go there directly. They'll categorize them and you'll get put into kind of another basket. And that's kind of how they deal with it. But we know that magnesium is a cofactor or does 800 enzymatic reactions in the body. And so if it's doing that much, it's touching pretty much every aspect of our body's way of whether it's biochemistry wise or whether it's as a cofactor or as an enzyme. There's just so much going on behind the scenes.
There are so many different types of magnesium, and I know it can get so confusing. Even for me, I look at it and I'm like, okay, what do any of these mean? So how do we wrap our head around it and how do we know which one to take?
Yeah, so there are unfortunately a lot of different kinds of magnesiums, but there's really probably about six different forms, five or six that we really can focus on. So these are going to be the most popular forms that we see on store shelves, whether you go to a health food store or a pharmacy. So we have magnesium bisglycinate or glycinate. It's the exact same thing. And this is a really good all-around form of magnesium. So if you kind of want to hit on a lot of different small things, this would be the form that I would use. But it's also very, very much indicated for sleep and stress because glycine is a very relaxing and calming molecule. And that molecule is attached to the magnesium. And just to back up a little bit, we need that molecule to actually get magnesium into the cell because we can't just take magnesium unless it's through food and then it's coming in with other things and that allows it to get into the cell. But if you're just taking a supplement, magnesium on its own cannot get in unless it has a little bit of a helper. And that's why we have these different forms of magnesium. So that's the bisglycinate, glycinate, and then the other one is citrate, which is quite common, and we use that for digestion mainly. There's also some research for migraine prevention with citrate, around 600 milligrams, and then also digestion being acid reflux and constipation. It's really good for those because it kind of allows for water to get into the bowel, and then it softens the stool and helps to allow for a good bowel movement. We then have something called magnesium malate. And so this form of magnesium is part of malic acid. And so it's in the Krebs cycle. So it's going to make lots of energy. So it's great for people who have like a lot of fatigue issues, chronic fatigue syndrome, just low energy. And then it's also very good for muscle and joint pain and just pain from fibromyalgia is actually really indicated for magnesium malate. And then the other thing malate does, which is really nice, is it allows for aluminum, heavy metal reduction. So if you have a lot of aluminum built up in your system, then you can take malate, and malate seems to chelate it and get it out of the system. So that's really great part of that.
How,
And
I have
then
a question. How would you know if you have a lot of aluminum in your body?
you can actually get a blood test done.
Oh, okay.
Yeah. Yeah, or a hair analysis, right? Some people will test a strand of hair and it can tell you if you've got heavy metals, or you can also just ask for a blood test from your family doctor and they will run it and you'll see if you have too much aluminum. Yeah.
Wow. Okay.
Yeah. hmm And then we go on to magnesium taurate. So this one is with taurine, and this form is really indicated for heart health, blood pressure. It is also good for sleep, and I sometimes also use it with diabetics, so insulin resistant and diabetes, because it's so good at helping to sensitize the insulin receptors. We have magnesium L-threonate, which is really specified to the brain, right? So it's the form of magnesium that can cross the blood-brain barrier. And when it crosses the blood-brain barrier, it can do all really great things for our brain health. So cognition, memory, focus. There's lots of studies showing that you can reduce your brain age by taking magnesium L-threonate. It's at a much lower dose when you buy it, and it's also more expensive, but it's really good for anything to do with, cognition, or we also use it in post-concussion, sometimes in mood disorders. Um, with sleep, some people get triggered by it and they can't sleep, and then some people do well. So it's kind of something you have to figure out. And then we have another form that you might notice or see on your shelf, and that's magnesium oxide. Now, magnesium oxide is it's prescribed a lot by doctors. I don't know why, but anyway, they do. It's a really great laxative. And I think if you're really backed up and you really need a good laxative, magnesium oxide will do the job. Other than that, we only absorb 4 to 5% of that form of magnesium. So it is not a good choice. Um, I think sometimes we have to be careful when we're looking at magnesium supplements that have more than one form in there. Sometimes oxide is put into that, but they won't list how much of each. And so magnesium oxide is a very inexpensive molecule. And so you wouldn't want your magnesium formula to be predominantly oxide, right? Because we are not going to absorb that, and you're likely going to have a laxative effect from it.
And you don't want that unless you do want it, but you otherwise you don't
I
want
use it, yeah, if I have to have a bowel clear out with patients or something like that, or I have very severe constipation, I will use it because remember, we're not absorbing it, right? So it's kind of just going through us. And I mean, if you look at what they use in a colonoscopy prep, a lot of it is magnesium,
it.
right? Like, yeah, yeah. So the Picolax and all that stuff that you take, it's just magnesium because that form is just, it's like obviously it's in very much higher doses, but it's just going to go through us and it's going to provide a laxative effect.
Interesting. What's the best way to absorb magnesium? Because I know there's capsules, there's tablets, there's powders. So, like, which one would you recommend is the best way?
Yeah, so I think we have to look at what's being added. So with a capsule, most times they're pretty standard. I try to stay away from, they usually, some of them might put in fillers or colors or something like that. But magnesium stearate is a really like cheap filler that they put in. I try to stay away from that. So just looking at the ingredients, but most times capsules are going to be your safest bet. Now, if you can't go with capsules and you go with a liquid form or a powder form, you really want to look at what they're adding to make it taste better so you'll take it. Because a lot of the times, that negates you taking it. So, a lot of times in the liquid formats, they're adding a lot of sugar content. So, whether that's a sweetener, a natural flavor, or they're adding some form of color to make it look like orange or whatever it is that they're using. And so that is going to negate kind of your benefit from magnesium. In the powder, same thing. Now, magnesium glycinate or citrate in a powder form is not going to taste really great. So a lot of the times they're putting stuff in there to make it more palatable, but sometimes that can backfire on us as well. So it's really important to read the ingredients and see what's in that supplement. But otherwise, they're fine across the board. I get just as great of benefits from a capsule versus a liquid versus a powder. It's really patient preference and whether or not they can swallow a capsule or not.
Okay, yeah, because I take a magnesium right before bed. It's a tablet, so I swallow it, but I feel like it could probably melt in my mouth also. Like it's not a capsule fully, but I love that over a powder because I don't want to make a drink at night. I want to be able to just like pop it and go to sleep. So I'm
Right.
always curious like how people like you'd like to take it, but that's good to know that you could do any of them.
Yeah, and in kids, we often do that, right? So they're not going to be swallowing capsules. So we often use the powder or the liquid format. Yeah.
Okay. Okay, interesting. Are there any other, I know you mentioned some things to look out for in the powders. Is there anything else that you would avoid that maybe sometimes they include?
I would just probably make sure that if you're getting like a formula of magnesium, that it's not, or at least if it does have oxide in it, it's listed as to how much is in there. And if you don't know and you really like the company, then call them and ask them because if they don't want to disclose that, then that would be my red flag to probably not take it. Because if a formula has, let's say, glycinate and citrate and malate and then oxide, all those forms of magnesium are different cost value. And if the magnesium just says 250 milligrams, you have no idea if 200 of those milligrams is actually oxide, which would be a very inexpensive way for that company to sell that magnesium formula. So really, you're not absorbing 90% of the capsule that you're taking or powder or whatever it is that you're doing. So I definitely would look at that. Obviously, like I said, unnecessary dyes, fillers, or artificial additives. If it's got too many of those in there, you're really not going to get the benefit of the magnesium. And then I like choosing chelated forms because we know they absorb better. So magnesium bisglycinate and taurate and malate come in chelated or buffered forms. So chelated forms means you're going to get a little less magnesium in the capsule because magnesium is actually a big molecule. So if you have a magnesium capsule that is like 500 or 800, you really have to be cautious because that's not possible. Most companies, 200 is the max that they can put into a capsule, unless you've got oxide. Because oxide, you can do an 800 capsule. I've even seen 1,000 milligram capsule. So just making sure that, you're not taking, a 500 milligram capsule and it's glycinate because it shouldn't be that way because it's too big of a molecule. So the chelated forms are good for absorption. Buffered means you're going to get a little bit more magnesium, but then it's going to come with a little bit of GI upset as well.
Oh, interesting. Okay. And it will say that on the bottle?
Yeah, usually we'll say chelated at the front or on the back where you see which magnesium you're taking.
Oh, wow. Okay. And then because you brought up formulas, for example, I just take like magnesium glycinate and that's
Mhm.
it. Sh
Yep.
Is it okay to take the formulas or should I almost be buying like separate ones and take them all, if that makes sense?
Yeah, the formulas, the problem with the formulas, none of them are at therapeutic levels. So if we're looking to address, let's say, stress and sleep support. If I give you a formula, you're going to get a little bit of each, and it might not be therapeutically enough. And so if I give you glycinate and I know it's 200 milligrams, then you're getting glycinate at 200 milligrams and it's at a therapeutic dose.
Hmm.
And so with the formulas, it's a little bit harder because we can't actually reach therapeutic dose because we don't a lot of these formulas do not break down how much magnesium of each form they're using. And the other one, it's just like a flat out 250 milligrams or 500 milligrams or something. So we don't really know what is what in there. And so it makes it a little bit harder to, you know, blanketly give to somebody for a certain reason or a certain health issue. I tend to stay away from them when I'm treating patients because I want to make sure that that patient is receiving A, the therapeutic dose, and B, the right kind of magnesium.
What is the right dose? Like, can you take too much magnesium?
You can. I would say, like, While the recommended dietary allowance, magnesium is 310 to 420 milligrams for males and females. So females, it's 310 to 320, males, 400 to 420 milligrams per day. That is the minimum required to not have a deficiency. So you need to be getting in that much magnesium every single day, whether it's through food or through some form of supplementation. Now, is that going to be enough? For some people, maybe. For some, most people, not. Those RDAs have not been updated since like the mid 90s, early 90s, and RDAs are based on weight and gender. And so we had a study that got released in 2021, I believe, and it showed that actually our weight has increased by 20 to 30 pounds, which would mean that that RDA is actually outdated. And they had suggested that we need to add somewhere between 100 and 200 milligrams in addition to what the RDA is now. And I would say that most times, in most cases, I am dosing patients somewhere between 400 and 600 milligrams. Now, can you overdose? Yes, of course. Is it going to be detrimental to your health? It could, depending upon if you have certain health conditions. If you're going to be overdosing, the most common side effect is you're going to have diarrhea and some GI upset. The minute you cut back, the diarrhea stops, the GI upset stops. It's a very simple method. Now, because magnesium is released through the kidneys, we have to be careful with people such as maybe diabetics that have kidney involvement or kidney damage or some form of kidney disease. Any person who has kidney disease in any stage, we have to be more careful when we're dosing magnesium because this is how it's eliminated from the body. So your biggest side effect, diarrhea and GI upset. And you're likely going to know when you hit that because it will likely be just diarrhea.
My doctor one time told me, she was like, take as much magnesium as you want, just stop once you get diarrhea. And I'm like, okay. I was so confused, but I'm like, all right.
I mean, sometimes I will also suggest that, or like even with vitamin C, it's the same thing, right? Just take it to bowel tolerance and then back it up by like maybe one capsule. But yeah, I would say most people are between 400 and 600 milligrams, somewhere in there. How I usually did like work out is I look at the patient, I look at what they're complaining about, what their health condition is, and then I look at everything that could possibly be depleting the magnesium. So are they taking medications? Are they super stressed? Do they have a blood sugar problem? Are they, working out 5 days a week and sweating? Are they like drinking 4 cups of coffee per day? Like these are the things I look at. And then from there, I can be like, okay, you know what? They're dispensing a lot of magnesium in the day. So I will dose those individuals higher than somebody who maybe only has 1 or 2 of those.
Wow. Okay. So I want to dive into leg cramps specifically, and I'm going to give a tiny backstory for you so you know. It was back in 2022. I had the worst leg cramps I think I've ever, actually body cramps, mostly in the legs, but I had body full. I had like ab cramps occasionally. And magnesium is what ended up, I feel like, curing me. It took a very long time though. I had leg cramps for almost 9 months, and I had to take a magnesium consistently to eventually get them to go away. But why does magnesium help with leg cramps?
Yeah, so leg cramps can be anything from like, I don't know if you had them more at nighttime. We sometimes also categorize them into restless legs, which happens during the day or at night. But those are usually true signs of magnesium deficiency. So you're probably at a point where you really don't have enough magnesium to support all the 800 enzymatic reactions that this mineral is actually responsible for. So when your muscles don't have enough magnesium, they're going to stay contracted instead of being relaxed. And so that is what is happening in a leg cramp. Things are contracted and tight. And so when you don't have enough magnesium, you are going to feel stiff, tight, tense. right? So those are kind of like the main symptoms. And then obviously repleting that magnesium and depending upon what was going on in your life, how much you were actually depleting every day, your body is going to prioritize what needs to get done in order to sustain life. And leg cramps are not one of them most
Oh,
times.
and I actually, it's funny because I found this out later, but I had a gluten sensitivity that I didn't know, and I was having other reactions as well. So that makes sense what you're saying is depleting because I had other things just going on health-wise.
Exactly. And so the body is very smart and the body will take care of what it needs to take care of, and the rest goes by the wayside.
So
And
that's why it took so long probably to cure.
replete, replete, replete. Yeah. Yeah.
Wow.
Because it's not a simple thing as you taking one dose of magnesium and your deficiency is gone. You have to remember that when there's a mineral that has this many jobs, everything from like, I mean, it does everything from ATP production to DNA, RNA, like it's got a lot of jobs. And if it has to do certain things, it will do only the ones that are most important. And it will only do that until it feels like it has an abundance of something else. And then we might get more, you might have had that resolution of that problem, but in your case, it was 9 months. And so, malate and bisglycinate, these are great forms that can help with leg cramps. And so, yes, taking one of those would have then eventually got you back up and repleted.
And I know a lot of other type 1 diabetics have get leg cramps occasionally too, just from high blood sugar. And a lot of people, when they first are get diagnosed with type 1, is when they have that as well, the symptom of leg cramps and just other things. So that makes a lot of sense now.
Yes, yes, yeah. So it's actually a very common symptom of magnesium deficiency.
So I don't want to get too scientific, but I'm just curious how like magnesium even is made, the supplement. I'm like, where does it come from? I don't even understand that part of it either.
Um, yeah, so it's not magnesium is a mineral, right? And so it comes from like the earth. And that's kind of where we get it from. But remember what I had mentioned earlier, we can't just take that magnesium and like absorb it. We can't do that. So magnesium has to be put together with another amino acid or another molecule to actually get the magnesium into the body. Now, where that does not apply is if we're eating magnesium-rich foods, because magnesium-rich foods are grown from the soil, and then like I just said, it's a mineral that we have that comes from the earth's crust. And then it's in our soil, and then the plants take it on, and then you eat the food, and the magnesium is transferred. Magnesium is mostly in plant foods for that reason. It's not a lot in like meats, in animal proteins. Salmon has a good dose, but again, we're probably looking more at plant-based feeders there that is going to increase that magnesium. But it's not something that we can just pick up and just take magnesium on its own. It's always has to be combined with something.
Oh, very interesting. Should your magnesium supplement be organic?
No, I mean, there are organic versions, but
It's not
it's
important.
not, yeah, it's not, I don't really ever make an assumption of having organic magnesium.
And then earlier you mentioned like stomach pain or acidity, wow, acid in your stomach. I'm like
Yeah.
acidity. Which one did you say again was good for that? Which
So
magnesium?
that's magnesium citrate.
Citrate. Okay. Because that's another symptom I've been having lately, unfortunately, is I'll eat chocolate actually, and then immediately after having chocolate, I'll be running to the bathroom to go let it out. I puke it up. And so that something like citrate could help with that.
Yeah, so chocolate is one of the like for acid reflux, it's one of the trigger foods.
Mhm.
So it will trigger a reflux. And so yes, yeah.
Wow.
Mhm.
It's crazy. Magnesium is like so powerful. I am the biggest fan of magnesium because it solved my leg cramps several years ago. But I'm like, wow, you can literally take a different type of magnesium for every problem that you have.
Exactly. Yeah. There's so many forms, and I mean, I think if you have a lot of things going on and sometimes people are like, oh my God, I have all of these symptoms, then I usually tend to stick with bisglycinate and glycinate because it's just a really nice all-around form. You're still able to get therapeutic doses and you're still able to get that magnesium to get into the cell. So it's definitely the one that I go with if there's lots going on. But if there's some, one or two really specific symptoms, then I'll choose the form that is most appropriate for those symptoms.
Okay. Is there a specific brand that you like, or should we just be looking at each one and making sure there's no of the added ingredients?
Yeah, I mean, I'm in Canada, so I don't know what's available in the States, but yeah, brands are, I would look at all of the ingredients. I sometimes use something Designs for Health, NFH is here, Thorne is here, Pure Encapsulations. Like those are kinds of brands that I have used in the past or use with patients. But it's really just about looking at the ingredients because depending upon where you live, you could have totally different brands, but that doesn't mean that the magnesium is bad.
How do you help your patients? Or is it solely for magnesium, or do you do all health?
I do all health, yeah. So my clinical focus is on metabolic health, women's health, and inflammation, so inflammatory conditions. So magnesium's used in all of those. And yeah, so I use it a lot and I find a lot of benefit from it. I find like people get a quick win with it, and also get, long-term support and help.
This is a little off topic, but I'm also curious about iron, if you know a decent amount about iron. Does iron also help with leg cramps?
Yeah, so if you have something called restless legs, which I mentioned, so leg cramps can fall into the category of restless leg syndrome. Restless leg syndrome, one of the top underlying root causes is iron deficiency. So if someone's coming in with leg cramps or restless legs at night, or even during the day when they're sitting at a table or on a couch, then the first things I'm looking for is, are they magnesium deficient? Are they iron deficient? And we usually will run blood work to make sure that iron is sufficient. And in that case, I don't often just run ferritin because ferritin is also an acute phase reactant. So it's sometimes if there's inflammation going on in that individual's body, the ferritin can be elevated falsely or acutely. And so I don't know what they do in the States, but in Canada, our doctors run ferritin. And then if ferritin says 80, they're gonna be like, no, you're fine. No iron deficiency. But then when I run an iron panel on that patient, they will have like no iron. So they're deficient. So that ferritin was actually buffered by inflammation. And so, and our doctors here are not allowed to run ferritin and an iron panel at the same time. So they can only run one or the other. So they usually always run ferritin. So I always, say, if you're going to run ferritin, you need to run an iron panel too, because you can't trust that that number is accurate.
Oh my gosh, this is such good information because I also, after all those leg cramps, I actually finally went and got an iron infusion. There's some backstory to this, but I went and got an iron infusion and my leg cramps also disappeared. And it took so long for the doctors to figure that out. I'm like, "Ugh, now I know, but I'm like, why aren't doctors looking up my iron? But you know what? They did test my iron and it said, or the ferritin, and it said it was normal. Yeah.
Yes. And that's usually how most people get kind of swayed out and they're just told, oh, your iron's fine. And then I'm like, okay, so let's look at your iron. Let's look at what your iron's actually doing in your body. And they're like, well, they won't run it. So then I run it and it's like low, it's like 2. And I'm like, okay, this is probably the reason why. So
Yeah.
yeah, you really have to advocate. And I get why medical doctors run ferritin. It's easy, it's quick, and you know what? Here they have to run one or the other, and it's cheaper, and that's just the way it's done. But definitely you have to look at iron deficiency because it is a big root cause. Yeah.
Are there any other supplements you recommend for someone living with type 1 diabetes?
Usually it's a lot of it is diet related. I do recommend magnesium when we do have a type 1 diabetic, just because they can use it so much because we don't have an insulin receptor that's working. So they're going to have insulin issues. It's just going to support the body and support the individual. And then it's really based upon what they're experiencing. So, I mean, I know when I'm working with type 1 diabetics, my goal is to get their blood sugar in an optimal range, not 6.5, not 6. I'd like to see it around 5.8, 5.7. I know it's a little higher than, the 5.5 or 5.4 when we're looking at hemoglobin A1C, but there should be no reason why we're not trying to get to that amount. And I don't know how it is in the States, but here, 6.5, they're like, oh, you're doing great. And I'm sure that they are, but it can be much better.
Yes, yes. For a type 1, it's obviously very challenging since we control our own pancreas. But yes, I
Right.
mean, I agree with you. There are so many lifestyle things we can also do along with taking insulin, so to get it
Right.
under the 6.0, so I totally agree.
Yeah.
So how, if someone wants to get in touch with you, how do they find you?
Yeah, so I'm most active on Instagram at Dr. Barb Woegerer. I also have a website, which is barbwoegerer.com. And if you want to find out more information on magnesium, I last fall co-authored and released a book with Dr. James D. Nicolantonio, all about magnesium. And so we cover all the forms, we covered all the conditions, diabetes, metabolic syndrome, cardiovascular, mood disorders. It's all covered in there. So if you want to find out more about this incredible mineral, then that is something you can pick up. It's on Amazon and it's called Magnesium, the Missing Mineral. So, yeah, so that's pretty much the two big ways of finding me. And yeah, and there's just so much that this mineral does, and I don't think it gets the attention that it sometimes deserves. And I guess maybe because it's just so, well known for sleep and stress, and that's kind of where we finish the conversation with magnesium. It's just not thought of in a lot of different things. And maybe just one more tidbit before we finish. One of the most important things that magnesium does is activate your vitamin D. And so when you look at vitamin D deficiency and magnesium deficiency, we're in the same bracket. And there's a reason why that is. So if you don't have enough magnesium, you can't actually activate your vitamin D in your liver and your kidneys. You need an enzyme that requires magnesium. So there's not a coincidence in why we see a lot of people deficient in both of those nutrients.
But vitamin D is something that you should get a blood test before taking, correct? You don't want to just start taking vitamin D.
No, so the recommended dietary amount here in Ontario, so what public health kind of says is the minimum amount is 2,500 IU. We don't have a very long summer here. We have winter and lots of clouds for a long time. So we don't get a lot of sun exposure. So most of the population here is actually supplementing with at least 2,500 IU. But yes, getting a blood test done, seeing where your levels are, and then dosing appropriately. But when you're dosing appropriately, make sure you've got enough magnesium there to actually activate that vitamin D, or you're just taking that vitamin D and that vitamin D is not doing anything for your body. And this is a big thing. And I see this a lot. I'll see vitamin D, people taking vitamin D, and yet their numbers are still below the cutoff. And I'm like, why? And as soon as we start to add in a little bit of magnesium and get some of that enzymatic reaction going, their vitamin D levels start to increase.
Wow, that is so
Yeah.
fascinating. And because you mentioned you're in Canada, can you help other people only in Canada, not the
Yeah, I work with patients right now only in Ontario. That's where I live and I practice. So I do have a in-person clinic that I work at, and then I also do virtual for anybody in the province of Ontario.
Oh, awesome. We do have some Canada listeners. So if if you're out there, go check out Dr. Barb.
Yeah, or check out my book or check out my website. I do have a blog, so I sometimes post some of that information there. So, or just on Instagram, I post, I'd say 90% of my information on Instagram is magnesium and how it impacts us, just because I feel like we need to bring some attention and awareness to this mineral. I've used it in practice and I only started using it. It's not like we learned about this in school. I went to 4 years of medical school plus a year of internship. And it was never really, it was a micronutrient, and that was it. We didn't really learn too much about it. And when I first went into practice, I had all these patients coming in. And here we have public health care. So when the doctors don't know what to do with you, that's kind of when they end up coming into my office. And they were like, well, there's nothing we can do now. And I was like getting on and PubMed researching, and every single thing was coming back at magnesium. Like, okay, I'm just gonna throw magnesium at this patient and see what happens. And you wouldn't believe the improvements that came through. And it was only after that that I really got involved and started just making more notations and research and all sorts of things. There's like 120,000 research articles on magnesium. So it's a lot of information.
And thank goodness you did that because that's how I found you too. I was searching on Instagram for magnesium information, and you're right, there's not that many people talking about it solely about magnesium. And so I was so happy I found you because I'm like, this is wonderful.
Yeah, there isn't really any. And when I was looking, I couldn't find any. And I was like, okay, you know what? We need to bring some awareness here. So, my Instagram account is primarily, I do some metabolic health on there, as well, because it's a big part of my practice. But I would say 90% is magnesium content.
Well, they go hand in hand, so that's great.
Yeah, absolutely.
Well, thank you so much for being here and telling us all about magnesium.
Thank you so much for having me, and it's been a pleasure.